Antihypertensive drugs. In this picture, we showed this is the Birmingham triangle. Uh, First, thiazide diuretics, beta blockers, DHPs, and ACE inhibitors or ARBs, angiotensin receptor blockers. And this is non-pharmacological advices for hypertension: reduce salt, reduce weight, reduce alcohol, and increase exercise. So this actually basically indicate that you could use thiazides with beta blockers or ACE inhibitors, but you can't use thiazides with DHPs. And same thing, DHPs, you could use it beta blockers with the ACE inhibitors or ARBs, but you can't use thiazides. And again, ACE inhibitors or angiotensin receptor blockers, you could use it thiazides with a DHP, but you can't use it with beta blockers. That is what this Birmingham triangle it's basically indicating. So first is diuretics, it's thiazides, chlorothiazides, hydrochlorothiazides, indapamides. So when you're talking about diuretics, you have to know what are diuretics, what are the side effects of diuretics. Diuretics are contraindicated in mainly in thiazides. Diuretics are contraindicated in diabetes mellitus. They are indicated in diabetes insipidus. And what are the mainly side effects? No, you have to know. So for that you could use the diuretic video. So for ACE inhibitors, again we did video about ACE inhibitors, future farsal technique, it's a mnemonic. So fosinopril, perindopril, ramiprils, captoprils, enalapril, lisinoprils, tandaloprils, covinaprils, all the prils, ACE inhibitors you could use for hypertension. And ARBs, angiotensin receptor blockers, valsartan, candesartan, losartan, all the sartans, and CCBs, DHP, dihydropyridines, mnemonic is NIP and VOL. There's also separate video for CCBs. And nimodifine, nifedipine, nicardipine, philodipine, benadipine, amlodipine, lesidipine, lesanidipine, and these calcium channel blockers. These four drugs, these four classified drugs: thiazide diuretics, ACE inhibitors, angiotensin receptor blockers, calcium channel blockers, and also beta blockers, cardioselective beta blockers. There's a mnemonic is new beta blockers act exclusively at myocardium. New means nebivolol, betaxolol, bisoprolol, atenolol, esmolol, isbutolol, and metoprolol. These drugs are prepared with diabetes mellitus, bronchial asthma, and hyperlipidemia. So these things, these four drugs, thiazide diuretics, beta blockers, DHPCCBs, and ACE inhibitors or ARBs, they are the main four classified drugs for as antihypertensive medication. So the in this video series, pharmacological video series, we talk about these autonomic nervous system acting drugs. We talked about ACE inhibitors, CCBs, beta blockers. The all we talked, they are used in like these diseases, antihypertensive drugs. If you know beta blockers, you know what are the side effects, what are the indications, and what are the everything about beta blockers, right? I think you get what I'm saying. So if you know those classified drugs, you know what drugs could be using for the hypertension. So they are more described in separated videos. So that's why we did those small videos to come here. So and we could use the disease better, and why we give these drugs, what are the contraindications, and everything. And other drugs are alpha 1 blockers, or also we talk about uh, adrenal blockers in that video about alpha 1 blockers. We talked about DPTs. D means doxazosine, P means prazosine, T means terasosine. Central acting also clonidipine methyl dopa alpha 2 agonists, they decrease sympathetic flow from centrally. And so hypertensive medications, you just have no thiazides, beta blockers, DHP, CCBs, and ACE inhibitors. What are the drugs, what are the mnemonics? So I always say, what is the main benefit of mnemonic is, so there's a severe content in pharmacology, you know. So if you know the mnemonic, listen to the mnemonic and the ending, like As an example, ACE inhibitors, the old drugs are ending with pills, and mnemonic is future partial technique. A for fosinoprils, P for perindoprils, R for ramiprils, C for captoprils, NL for lisinopril. You know the drugs, it will come to your mind quickly. So otherwise you have to make a drug which is not there. So that is why these are very important. And when you talk about beta blockers in as an antihypertensive medication, they are mainly indicated in young patient and anxiety patient and pregnancy. They are contraindicated in elderly patients and left ventricular failure. Left ventricular failure. Don't recommend if a patient has a left ventricular failure. And for the hypertension, don't recommend beta blockers. And asthma, very important. Asthma, beta blockers. We know for the asthma we use beta 2 agonist, salbutamol, albuterol, terbutaline, salmeterol, all the terols. So beta blockers, they are going to block those. So that's why when we are talking about beta blockers, that's why we talked about beta 1 selective one. Some beta blockers act exclusively at myocardium. Those drugs, atenolol, so there is nebutalol, betaxolol, bisoprolol, atenolol, esmolol, isbutolol, metoprolol. Even though patient is asthmatic patient, you could still use beta blockers, which is beta 1 selective one. So you can't use non-selective beta 1, beta 2 in antihypertensive as an antihypertensive medication in the patient is asthmatic. So next, CCBs, calcium channel blockers, indicated mainly in elderly patient. Pregnancy you could use in CCBs and asthma. So without fear, you could prescribe calcium channel blockers for a reason of for the hypertension in asthmatic patient because no side effects. And antihypertensives unsafe um, in a pregnancy are, first one is labetalol. Labetalol is you know it's a beta blocker. Labetalol, because it is hepatotoxic, and also ACE inhibitors. And ACE inhibitors will cause oligohydramnios. Oligohydramnios is nothing but when mother is pregnant and there's amniotic sac, no, so there's a fluid. Oligo means less, so less, it will cause less fluid in that's amniotic sac. So there will be teratogenic effects for the fetus. So that's why we cannot recommend ACE inhibitors in pregnancy, because teratogenic effect for the fetus due to oligohydramnios. So if someone asks why ACE inhibitors are contraindicated in or unsafe in pregnancy, you just have to tell oligohydramnios. If he asks what is oligohydramnios, it is because ACE inhibitors will cause less fluid in amniotic sac and it will cause teratogenic effect of the fetus. Simple. So common side effects of all antihypertensive medication is postural hypotension. This is a common side effects of effect of all beta blockers. So you have to know, so pharmacology is vast subject. You can't remember everything, but you can remember what are the important points that we have to know. So as an example, in uh, in which patients that you could use beta blockers as antihypertensive drugs, what anxiety patient in pregnancy, you could use beta blockers. What are the contraindications? Elder, left ventricle failure, and asthma. So that's how you remember pharmacology.